how you doing today? It's Geno here at DeMarais with Jen's. Yeah, that's his name. So today we are actually going to be looking at Jen's hip. Jen's had a minor incident. Would you like to give me a little more information?
Yeah, so about a year ago, I was out with my brother for his birthday and fell down some stairs and really twisted my left ankle.
Okay.
So that's caused me to walk with some serious knots and limps and stuff. So that's really caused my right side to overwork itself.
Gotcha.
So now I get some sciatic pain and stuff in there.
I gotcha. Okay, so twisting the left ankle has caused a buildup of just issues stemming from the baseline on up.
All the way up.
Okay. Of course, with that going on and that happening, evidence does show that with the ankle, it only takes 4 pounds to break the ankle, and they actually say it's more effective for an ankle break than a sprain because a sprain takes a lot longer to heal. During that process, what happens is the body does overcompensate, and you'll tend to limp on that left side where you sprained that ankle, so that right side does get a little torn up. However, that doesn't mean that the left side's still not experiencing issues. So what we're going to do today is I'm going to go ahead and take a look at some things, check out your range of motion in that left hip, look at that left ankle, and also just kind of see as far as the hips and everything if we have any compression of the sciatic nerve, because injuries like this can cause sciatica. And I think that that's a big thing that a lot of people don't know, is some injuries indirectly cause other injuries. So I think that's something that we should be working on. So if you want to do me a favor, lay face down. I'll go ahead and I'll take a look, and as I'm going over things, I'll check with you periodically to make sure that the pressure I'm applying is okay.
Top of the sheet or under the sheet?
You can actually lay on top of the sheet, and I'm going to place this up under your ankles. How's that feel?
That's good. There's tightness here.
Tightness in the right?
Mm-hmm.
Okay. How long ago was the ankle sprain?
September 2017.
Okay, so at this point what I'm actually doing is I'm checking out the areas of the ankle just to kind of see and decrease some of the inflammation that is still present. I'm doing some gentle traction. Jens, how's that feel?
Good.
Okay, cool. And what happens is when you do traction in an area where there's increased inflammation, you increase circulation, thus decreasing the inflammation and increasing range of motion. I know, tongue-tied, tongue-filled, right? There we go. Those are sounds that often happen when the patient reaches a point where their range of motion is decreased so much that sometimes a therapist can apply a stretch that can seem a bit uncomfortable. It can cause some discomfort, but after a while, Jens, do me a favor, take a deep inhale. Exhale through the mouth. Nice. How's that feel?
It's feeling better now.
There we go. So what happens is, during these stretches, when you feel like you can't handle it, that extra oxygen, when I say breathe in through your nose and out through your mouth, goes to the area where I'm stretching, and it helps for the muscle to relax. All right. So moving on from the ankle, as we go up the ankle and check the calf, that's kind of next in order when you're dealing with joints. The foot being the baseline, and with Jens having an ankle sprain, his ankle not only has already been compromised directly from the injury, but now his knee is indirectly compromised from the injury as well, because it's the next joint in line. So as we go up, the muscles between the ankle and the knee, the largest compartment will be the calves. So as I go through the middle of the calves, Jens, how's that feel?
That's sharp.
Sharp?
Mm-hmm.
Okay. I'm going to go on the outside. Turn the leg slightly. This way I'm able to actually hit the lateral portion of the gastroc, or the lateral calf, and I'm also able to check what are called the peroneus muscles, which are the side calf muscles. A lot of these are very sensitive, and a lot of people that get massages don't realize this, but these are also muscles that are affected with runners, and also athletes that participate in any type of sport that does involve at least 50 to 75% running. So what I'll do at times is I'll give a slight rotation to the foot, up to the knee. I'll place the palms on both sides, and I'll apply some pressure, only because Jen said it felt sharp. Slow and steady wins the race, and you don't want the patient to jump up off the table. So you have to take your time when you're doing what is considered a type of aggressive therapy like this that does involve a lot of pressure, and it's going to increase some circulation, and there's going to be some discomfort. So James, I'm going to apply some pressure, okay?
Mm-hmm.
If at any point it becomes uncomfortable for you, just say 7. Got me?
Okay. Got it.
Okay, so right now I'm focusing on the peroneus. The peroneus muscles are on the side of the calf. They lie next to the gastroc, or the main calf muscles. Jens, how's that feel?
Yeah, as you go further down the leg,
It's getting tighter.
yeah, tighter and tighter.
As I go down the leg, I'm also going back to where Jen sprained his ankle. So when he sprained his ankle, of course, the tendon that goes down into that area, it's been tightened. That's why these muscles are so tight now. Doing all right?
Mm-hmm.
Okay. I'm getting Jen's warmed up. With this next session, as we head up to the hip, Jen, you feel warmed up?
Oh yeah.
You ready for this next part?
I don't know.
I'm going to hit, now what I'm going to do next, which actually is the most helpful and the most beneficial, I went on ahead and I hit this part. Got a couple knots here, but my biggest concern, because Jens does have large calves, and over time with this injury, with large calves comes larger knots. That's just how it works. The larger your muscles are, the bigger your problems are going to be. So with that being said, Jens, how does that feel? Feel warmed up enough?
Yeah.
Okay. So next it comes to therapy. Again, you have to warm up the area before you get started. If you don't do that, you're going to cause a lot more pain than necessary. The patient's not going to come back. They're not going to trust you. So something has to feel good before you get started, and before it starts to hurt. I mean, it's just how it happens, all right? Jens, I want you to take a deep breath in and exhale. And breathe. Now at this point, what I'm going to do is, I've run into an area where it's extremely tight. At this point, I'm going to hold for a minimum of 3 minutes, or until this area where Jens begins to breathe regularly, it will release. It is going to literally melt like butter. And you'll notice the difference not only in Jens breathing, but the fact that I'll be able to move on. How are we doing there, bud?
Oh man, I feel it all the way up into my back.
There we go. And it just released. How we feeling?
That's amazing.
Okay, nice. Now, with each action that I do, Jen's calf is getting more and more supple. There's more and more blood flow. As you notice, there's marked redness. That's increased blood flow. When there's increased blood flow, there's increased healing. All right, that was the beginning portion. Things got tighter as we went to the bottom. So, we started at the top where the main bellies of the muscle are to apply pressure to release. What we're going to do is we're going to now slide down a little bit more. Tender in there, Jens?
Mm-hmm.
Alrighty. Take a deep breath in for me. Exhale. And then I enter. Yes. Keep breathing. This is a very sensitive spot for a lot of people, especially women because they wear high heels. FYI, a lot of my female patients that say I have to do it for my job, there's no job description that tells you you have to wear high heels. Just tell me you do it because you want to. And then I'll still work on your calves. Deal?
I won't promise anything.
How we feeling?
Better.
Good deal.
Oh.
All right. Now what I'm going to do is I'm going to shift my pressure over slightly to my left. Okay. My left
Okay.
and your left. You ready?
Mm-hmm.
Take a deep breath in. Shifting. Exhale.
Oh.
Nice. So we're hitting the second belly of that muscle.
Now, during this time, as a therapist, what is most important is to pay attention to your patient's breathing. If they stop breathing, what will happen is the muscle will begin to contract. At that point, it's rock versus hard place. Nothing's being done. I'm not being hurt because I'm providing the pressure. They're hurting themselves because they're holding their breath and they're tightening and contracting the muscles. If you cannot breathe, let your therapist know. You cannot get through a massage session without oxygen, especially a pain management session. Breathing is your best friend, just like yoga. To get through a stretch, take a breath. To get through pain management, take several. How we feeling, Jens?
Oh, it's getting there.
We're getting there? Still got some work to do?
Mm-hmm.
Okay. And we stay there. We haven't hit our 3-minute mark. Jens has been lucky today. Sometimes you run across patients where, again, it's a minimum of 3 minutes with training. At that point, we're waiting for signals to come from the brain to the area where they tell the muscle, hey, relax, this is what's going on. Therapy's being done. Let's increase some blood. Let's decrease some tension. And the tighter the muscle, the more signals need to be spent, the more pressure needs to go, the more time needs to be made. That's why our minimum time is 3-minute holds. How we feeling?
Great.
There we go. All right. Take a deep breath for me. Exhale and then release. Nice. All right. So that is how we want to start working on the calf, simply because we're going to be able to decrease now the inflammation that was in Jen's ankle right when I started. So I worked not only on areas of the ankle with the traction and the twisting, but then I also made my way up and I worked on the larger compartments of Jen's calves as well as the side. So what that's going to actually do is going to help assist with that tension that he's been feeling, and he's not going to start compensating from the pain on this side. He's going to start to walk a little more even, thus building the strength back up in this ankle and in this calf. More to come next visit as we make our way to hamstrings. Until next time, my name is Geno, and we're at Dean Ray Chiropractic. See you soon.